You are 52 years old. Tell me if this sounds familiar. You're in your 40s or 50s. You have taken care of yourself your whole life. You still work out. You still compete. You still think of yourself as an athlete because you are one. And now your knee is starting to give you problems. So you do the right thing, right? You go and see a doctor. But then what does the doctor tell you? Take it easy. Do low impact only. And then they say the most offensive thing ever. At your age. Here is what nobody in that office told you. The science says that they were wrong. Not a little wrong. Completely, measurably, provably wrong. And today, I'm going to show you exactly why. My name is Dr. Gayan Poovendran. I am a medical doctor and I specialize in sports and regenerative medicine. Over the last 15 years, I have helped thousands of golfers conquer their knee pain without resorting to invasive surgery. And by the end of this video, you will know what kind of training actually protects your knees after the age of 50, and you will have one specific thing that you can do starting this week that will change the way your knees feel on the course. Are you ready for it? Okay, let's go. Actually, before we go too deep, I did put together a free 5-minute warm-up guide specifically for golfers that have knee pain. It's called the Ready for Tee Off Guide, so grab it right now at readyforteeoff.com. It is absolutely free. There are no strings, so go get it, come right back, and I'll be waiting for you. Okay? Here is the story I see in my office almost every single week. The guy walks in, early 50s, smart, successful. He's a former athlete. And that identity of athleticism never left him. But now his knee is starting to talk to him. He's got a little bit of stiffness on the back nine. He has a shot that he had to lay off on because the follow-through hurt. He had a round that he cut short. So what does a smart guy do? He does that. He goes and sees a doctor. He gets an x-ray. And then the doctor gives him 4 minutes and says some version of the same thing. You've got some wear and tear. It's normal for your age. Just slow down a little bit. Do only low impact exercise. And since it's still hurting, have a cortisone shot. Now the shot works for 6 weeks or 12 weeks or however long it works, but then it stops. And then he goes back and then he's on this carousel. And now somebody is mentioning the word surgery. And he's not ready for that conversation. Not because he's in denial, but because he's a guy who has invested in his body his whole life. And he knows that there has to be a better answer. He just doesn't know where to find it. That feeling that a guy like you deserved a better conversation than you got, well, you're right. You were never given the full picture. Nobody explained the difference between a joint that was wearing down and a joint that was being undertrained. That difference ends right now. So there is a large study published in Arthritis Care and Research magazine that followed thousands of adults over time, and it compared those who did regular strength training exercises to those who did not. The people who trained had a 20% lower rate of knee arthritis. Listen to that again. 20% less knee arthritis, not just less pain, less disease. The joint itself was in better shape. And here's the part that matters most for you. The researchers found that the meaningful protective benefit showed up even in people who didn't start training until they were after the age of 50. So if you have knee pain, you didn't miss your window to prevent it. There is no window. So how does that work? Here's the biology, and I'm gonna talk about it in plain English, I promise. Your knee has cartilage inside it, right? That's like the white, shiny end of the chicken bone. That's the cushioning material between your bones. Think of those like the shock absorbers in a car. The old story always used to go, well, that cartilage wears down with use and is inevitable, so just rest it if it hurts and go easy. Here's the problem with that story. It's wrong. And I say that as a doctor who spends a lot of time cleaning up after that advice. Professionally speaking, I am not a fan. What the research actually shows is that the cartilage responds to load. So when you move, the motion circulates what's called synovial fluid. That's the natural lubricant fluid that's inside the joint. And what that fluid does is it feeds the cartilage. So a joint that stops moving regularly gets thinner cartilage over time. I'm gonna say that again. It gets thinner cartilage, not thicker, thinner. One study found that inactivity leads to measurably thinner cartilage, while moderate, regular exercise can actually increase your cartilage thickness. The joint gets better when you train it correctly, not worse. So a 2024 systematic review looked specifically at quadricep muscle strengthening. That is the muscle on the front of your thigh. And this was in people that already had knee arthritis. The results were staggering. A 35% reduction in pain and a 33% improvement in function after 8 to 12 weeks. This is without surgery. This is without injections, just consistent, targeted training. 1/3 less pain, 1/3 better function from training. And here's why. The muscles around your knee, the quadriceps in the front, the hamstrings in the back, the glute muscles behind everything, well, they're your joint's armor. They absorb force before it even reaches the cartilage. Strong muscles means that the joint barely feels your body weight. If you have weak muscles, the joint, which means the cartilage and the bone, takes every pound directly, every step, every swing. Now, remember that terrible advice you got in the past from the doctor about low impact? Well, let's be real. The golf swing is a high velocity, high rotational load. Your knee absorbs up to 4 times your body weight in compressive and rotational force at impact and through the follow through. Those are the 2 moments that are responsible for the majority of knee damage in golfers. So strong muscles around that knee absorb and distribute that force the way they were designed to. If you have undertrained muscles, the joint takes the full hit. Over 18 holes, that is close to 100 reps of unprotected stress. That is not an age problem. That is a physics and biology problem. And physics and biology, fortunately, respond to training. One more study, one more number. A 2024 study confirmed that low muscle mass, in medical terms something called sarcopenia or age-related muscle loss, is directly associated with a significantly greater risk of developing knee arthritis. So after 50, we lose 1 to 2% of muscle mass every year if we don't resistance train. That is a structural problem that has a very trainable solution. So here's the one behavior change I want you to walk away with today. I want you to add 2 sessions per week of lower body strength training. This means work on your quads, your hamstrings, your glutes, and this is to protect and rebuild your knee from the outside in. 2 sessions, structured, progressive, consistent. That's it. Now, let's give you both sides of the argument because you're an adult and you deserve an honest version and you get to make the decision on your own. So, reason number 1, your muscles are your knee's only external armor. So if you do this, every rep that you do builds a force-absorbing system that intercepts load before it reaches the cartilage. Meaningful protective benefit at 2 sessions per week. The research and the evidence is very clear on this. If you don't, well, then the muscle loss continues. And that goes at 1 to 2% per year. The joint ends up absorbing what the muscles cannot. And the math works quietly against you every round, every day, every year. Reason number 2, contrary to popular belief, exercise does not wear out your cartilage. Inactivity does. If you do this and you follow my advice, the motion that you do during exercise circulates synovial fluid, it feeds the cartilage, and it actively maintains the biological environment inside the joint. Motion is lotion, and that is not just a bumper sticker, it is a mechanism. If you don't do it, well, then the fluid sits still and it gets stagnant in a pond. The cartilage gets less nutrition. Sedentary joints deteriorate faster than trained ones. That's a fact. Resting a hurting knee is not always what it needs. Now, rest has its place, but that is not our primary solution. Reason number 3, and this is what separates finishing 18 strong from limping off on the 14th. If you do this, your lead knee is prepared for the rotational demand of the swing. The muscles fire, the joint tracks. You finish the back 9 the same way you started the front. And if you don't, well then, every swing becomes a negotiation between the unsupported joint and the ground. It's not enough to stop you today, but it's enough to narrow down your options down the road. Reason number 4, your age does not mean that your athletic identity is in the past. If you follow this, you stay the guy who competes, the guy who finishes 18 and takes the bet because his body can back it up. The research says that you have more control over that outcome than you have been led to believe. And if you don't, well, then the quiet retreat starts, right? Fewer rounds of golf, more excuses, sitting out the skins game, not because you chose it, but because the gap got wide enough that you stopped fighting. All I'm asking you to do is to not stop fighting. Now, I want to be straight with you. For some of you, strength training alone will not be enough, right? The studies show that 33% of patients get better. So what about the rest? Well, if the cartilage is genuinely worn, the inflammation is persistent, or you've been dealing with this for months and the exercise is not taking care of it, well then your joint needs probably help from the inside too. Now that's where something like regenerative medicine comes in. So step 1 of regenerative medicine is usually something called PRP or platelet-rich plasma. What we do is we take a small amount of your blood, we spin it to concentrate the healing proteins that are already in it, and we inject it directly into your knee. This is utilizing your own biology, but it's redirected. There are no foreign substances here. This is not surgery. And this is where most of my patients start and finish, because a lot of them are active enough or proactive enough to never need to go any further. Step 2 is microfat or bone marrow concentrate, or BMAC. When PRP alone is not enough, we sometimes will have to move to something called cellular therapy or stem cell therapy. And which one you need depends on your specific situation. So what are they? Well, microfat is something that comes from a small fat harvest, usually from your midsection. So we do like a little liposuction, which most of us are happy to donate to a good cause, right? So then we take that, we concentrate it, and we inject it into the joint, and then it carries roughly 10 times the regenerative signal of PRP, and it preserves the joint's natural healing environment. And it does it in a way that isolated cells cannot do. So for patients where inflammation is the dominant characteristic, this is one that we often prefer. It's not a fallback, but it's the right call for the right case. The other stem cell option is BMAC, or bone marrow aspirate concentrate. Now this is also for advanced structural damage. So what we do is we go directly into the bone marrow where some of the body's most potent repair cells live. We concentrate them down and again, deliver them precisely into the joint. These are both heavy artillery. BMAC and microfat are both heavy artillery reserved for the cases that need it. Look, I don't pick from a menu. I look at your imaging, I look at your history, I talk to you about your goals, and I choose the right tool or the tools for where your knee actually is. You deserve that individualized conversation, not somebody else's protocol. Now, along the way or alongside any of those, peptides like BPC-157 or thymosin beta can help. Think of them as your body's text messages. These are short signaling chains that tell damaged tissue to repair faster. These are a force multiplier alongside injections. They are not often a standalone fix, but they can make everything else work better. So here is the picture that I want you to carry out of this video. It is Saturday morning. You're on the first tee. The bet is on because you've been talking smack to your buddies all month. You have been putting in the work for the last 8 weeks. Your knee is not what you're thinking about as you address the ball, right? You were thinking about the shot. You were thinking about the trash talking. You were thinking about the win, the flag, the win. That is my win. That is your win. That is not a miracle. Just finishing 18 the same way you started, feeling like yourself. That, my friends, is available to you. The research says so, and I see it in my office every single week. Now, here is the one exercise I want you to do today, right now. This one is called the bodyweight squat with hip opener. So you're gonna have your feet shoulder width apart, and you're going to go into a slow, controlled squat. Now, at the bottom of the squat, I want you to open your knee out on one side and hold it for a beat. Then bring it back and then stand up. Then alternate sides, so do the same thing on the other side. Do 1 set, 6 reps per hip. My coaching cues here are simple. Chest up, weight through your heels, and do not let your knees cave inward. Make sure that you're doing this slowly, controlled, and deliberately. Why this matters. This exercise specifically activates your glutes and your hip stabilizers. Those are the muscles that are supposed to absorb the load during your swing before it ever reaches your knee. So for most guys who have been sitting at a desk all week and stepping straight onto the first tee, well, those muscles are basically asleep. So this exercise wakes them up. Now for the complete 5-minute routine, all 6 exercises that are illustrated in the exact sequence your knees need, go grab my free Ready for Tee Off guide at readyforteeoff.com. Pull it up on your phone before your next round. Your knee will feel a difference before you even reach the second hole. So if this video gave you something that nobody in a 4-minute office visit ever did, please share it. Not just as a random post, but share it with the guys in your group. The one that's grimacing on hole 13 but says nothing. The buddy who is trying to figure out his next surgery date and when it's not going to interfere with the rest of the golf season. Send it to him first, actually. He deserves the full conversation before he makes that call. And also, follow the channel. Every week, real science, plain English, for golfers who are not ready to feel old. And before you go, grab the Ready for Tee Off warm-up guide at readyforteeoff.com. 5 minutes before your round, that's it. I'm Dr. Gayan Poovendran. Now you know what most golfers will never find out. I will see you pain-free on the fairway.